Protection, care, and support is one of UNICEF's priorities in addressing the needs of vulnerable children, and REPSSI was one of our leading regional partners working in that area, and we both agreed that one of the critical areas of need was an increased cadre of community-level care providers that had training and experience in providing psychosocial support services, because the biggest issue we were facing was how to get those services down to the community level and the people that needed them.
I'm the chairperson in this CCD center.
I'm currently based at the Kisumu Children's Remand Home.
I'm a news counselor,
executive director,
program assistant,
volunteer children officer,
primary school teacher,
national youth chairperson.
St. Lucia initially was the organization working with children who are HIV positive, abandoned due to stigma of HIV/AIDS. The orphanage could raise more than 30 children, but the certificate cause have supported me to work with my board of trustees to change the focus. The cause gives us opportunity to understand how to develop the community who are facing various adversities, including HIV/AIDS. This approach helps us to not concentrate with the few children at institutionalized care, but focus more at community level with more children. Now we have moved from caring of 30 children within the institutionalized care, and now St. Lucia has reached more than 9,000 children at community level, working with various committees members which have been engaged with the skills from the certificate. So I'm delivering what I have from myself being one person, but now reaching more people at community level. The community initially had a stigma on HIV/AIDS, but after capacity building and trainings and giving them more knowledge on how to care for children who are having long-term illness, they are now happy and confidence, and thus has reduced the stigma level. And also this approach has enabled us to work with the government. As you can see, the structures were there, but we did not have skills and approach to know that we can incorporate the government and other stakeholders who are working with the children. Now we are working closely with the community and work together to identify their needs and plan for their priorities, and then find together the best solution on their problems. You see, now we've been working with all the 30 children, but you can see now how we go to all these families and touching many lives. So that's what makes me happy. Yeah.
I meet children who have passed through many challenges, because these children come from different backgrounds, and you find that most of them go through a lot of adversities. They end up maybe running away from home. After that, maybe they are rescued, taken through the children justice system. And as you know, not everybody is trained in handling children. So when they end up in my hands now, they are already afraid, shaken, they cannot talk. Some come very much ill, and you see, they've been sleeping on the streets, out in the cold. So I have to talk to these children. I have to accommodate them. I have to find a way of making them comfortable and making them understand that actually they are in safe hands. This certificate has given me a lot of skills in handling these children. I've managed to understand that respect for human beings is paramount. So I meet children, different kind of children, and the first thing that normally comes in my mind is that this one is just a human being like the other human being. Yes, and I should handle this human being with a lot of respect. Yes.
I've taught for almost 26 years. Ever since I had been wanting to become one of the university students, but I had no chances. So now the chance came while I was as old as I am. I learned about the children's rights. At first, I could see the street kids, but when they were begging, I said, these children, they are thieves. I didn't know why they were found in the street. But after the school certificate, I had learned more that those children were found in the streets because of several problems. So I learned to love them after the school certificate, that I started chatting with some of them. I even connected some to the CBOs. Some started school.
As volunteer children officer to the government, I reach the cases, especially for child abuse cases. We were addressing issues of the children in general, but this course has assisted me to come and realize that girls are more vulnerable, especially when it comes to abuses. After starting this course, I came to identify some gaps, especially addressing the issue of girl child. So I came up with a group advocating for the right of a girl child. This after realization of many problems that this girl, especially staying in Busia, these cases of child early pregnancy, this case of a child dropping out from the schools, and the high number of orphanhood within the municipality. I got the endorsement from the district gender officer who came and registered me. So today, I believe, through the kind of skills I have obtained on the resource management and networking, I want to network with other stakeholders and mobilize resources to support these children, especially who are most vulnerable, like the girls I'm talking about.
Here at the center we've got 30 children, that is 17 girls and 13 boys. In the center here we do feeding program. We have learning and playing materials. We've learned about how to know the status of a child, and this has helped me a lot to work with these vulnerable children, because we find in the community we've got those children that are really vulnerable. So the course, I can say, has helped me a lot as a student, because now I know how to handle such children. Because of the course, I normally visit the child, the family, to see how the child is faring on.
I'm a primary school teacher here in Malawi, and I'm also a volunteer at Malawi Girl Guides Association. Before certificate, when I meet such a learner that he's maybe reporting to class very late, I was just chasing them away, maybe even giving them some punishment. Not knowing that if I'm giving those punishments, that means I'm adding some troubles, some challenges to them, instead of maybe assisting what that child is facing maybe. So I was just treating them anyhow. Hey, you are not performing well, maybe you can just leave school and do what you want to do, not counseling them, not giving them psychosocial support then they are lacking. I was just doing anyhow. And now I'm able to call them, to counsel them, to assist what I can assist them at that particular day.
Our organization works with children who are HIV positive and orphans. The certificate has helped me to meet the needs of the families the caregivers, when they come, we sit and talk and they share the different things they are going through. I've been able to use the different skills that I've learned from the course, just to be able to empower them. A caregiver coming, feeling down, feeling emotional, but after going through sessions and counseling them, they've been able to leave the session feeling encouraged, inspired, and called higher.
The ECD, it is the community school whereby we have the children there who are left by their parents. Some live in poverty. Since I started this certificate course, it has really helped me. I have achieved the knowledge whereby I'm sensitizing the community people that let's just look at that child as of the community. He or she belongs to the community and he needs our assistance. So we should all just come up as the community to assist that child. Then it will be okay.
I'm a nurse counselor working with families, children, and other communities that are affected with mostly HIV. You'd find that children were not told that they were HIV positive. The parents get their children tested without their knowledge. They are started on ARVs. Parents come to collect drugs for them. But with the certificate course, I realized the need to involve these children in their care. So I educated the particular parents who were coming to collect drugs for their children that it was necessary for them to bring them for reviews so that we could counsel them, so that we could give them the information. And so far it has helped quite a lot.
At first I was thinking like it's not good to work as a volunteer because we didn't receive anything. But after undergoing the certificate program, I thought it's good. Then that program made me, it's like it encourages me to still working as a volunteer with young children, to have a passion on children.
Okay, let's have your attention now.
My role in the certificate course is mentoring the students. I see them every 3 weeks. Generally, I take them through the session, mainly to facilitate the program in terms of just facilitating the group discussions, helping them with any questions that they might have. And I have seen many changes as a result of this program. First, with me, I have gained a lot in terms of skills and knowledge, and generally with my attitude, towards the children at risk. I've also seen lots of growth with the students, and I believe it's really helping the children that they are working with.
The work that these students are doing in the areas they are working already is giving a lot of positive results, and because one, they are able to understand children better, and therefore they are able to give very quality kind of service to the children. We have even gotten letters from organizations where the students are coming saying that this program has really made this particular staff even more effective than before. We have even seen areas whereby people who are seen as volunteers, but after joining the program, especially in the government, then the government is also recognizing their role, because the children they support seem to be having a better care, in terms that these people are able to talk to them, understanding where the children are coming from, and this to me becomes really a very big thing to the children of Kenya.
I've seen lots of changes in my students. There is one student who has started his own project, and that's very encouraging even for the others. Not only for those who are there, but I'm sure even for the organization, they would feel very proud about it, because in that way they're able to reach more people in the community.
The parents are so excited by the way the students are able to relate with their children. Information we are getting from different parts of the country is that their children are better cared for now than before.
It has also assisted me to link, because I came to realize that we have working with the children, you as an individual, you cannot manage. You need to, and that one we came to learn it in module 3, that we needed to work with other stakeholders.
Rather than leaving the child go without being attended to, I've been able to gain skills and know that I need to support this child. I need to refer the child if I'm not in a position to, to help the child get the needs.
This is a very unique program, that it is very practical, very relevant to the people who are working on the ground with the children. Very practical, because it gives them the knowledge they require and the skills they require to work with the children. The way the program is run in terms of bringing students together and discussing and then going to implement what they have discussed is also very practical for the kind of students we have in this program.
I'm proud to be one of their students that I qualified. I have a thirst and a hunger that if the chances are there, I should continue up to degree level if chances are there, and if God still keeps me alive.